Hi, my name is Jessica Saucedo, and for our Leadership Symposium today, I'm going to be discussing an article from the Journal of Community Health. This article is titled Health Literacy, Health Information Seeking Behaviors, and Internet Use Among Patients Attending a Private and Public Clinic in the Same Geographic Area. The authors of this article are Natalia Gutierrez, Tiffany Kendrat, Patty Pagels, Barbara Foster, and Nora Gimple. This article discusses how patient-provider communication is extremely important and key in delivering the highest quality care of patients of all literacy levels. As healthcare managers, we deal with patients of various literacy levels on a daily basis, so understanding how they get their information and how we can effectively communicate with them is important. The aim of the study was to examine the primary source of health information of patients of various health literacy levels. With today's world, there's so much information available on the internet and other electronic sources, and many patients may look there to get their health information. To tie it back to literacy, patients with lower literacy levels may have a lack of access to internet and may lack that source of health information. So that's what the study just wanted to look at. In order to do that, they examined 2 clinics from the Dallas area. Excuse me. One was a county clinic and one was a private clinic, and the patient demographics in each were extremely different. The county clinic has a higher population of Hispanics compared to Caucasians in the private clinic, and the education and income levels were much lower in the county clinic than the private. To do the study, a survey was given upon check-in to the patients over a 2-month period, and the survey was delivered in English as well as Spanish and had a series of questions to collect demographic and socioeconomic information. It also included an NVS survey, which included a picture of a nutritional label and required the patients to answer 6 questions that had to do with interpreting that label, and that is how they assess their health literacy. There was also a question about patients' confidence in filling out medical forms. The findings of the survey were that in the county clinic there was a very limited health literacy level compared to an adequate level in the private clinic. There was also many in the county clinic that reported no internet source, while in the private clinic a high percentage reported an internet source readily available and familiarity with using that source. The surprising thing that they found was a higher than expected confidence level in filling out forms in the county clinic. With the lower limited health literacy level, they expected the confidence in filling out forms to be lower, but it was actually close to where it was in the private clinic. They also found that both clinics had a higher population that reported their provider is their primary source of health information, regardless of their internet access. The strengths of this study are the sample size. They surveyed 498 patients among the 2 clinics. And the other strength is the diverse patient population that they surveyed. They surveyed males and females, patients of various races, patients of various income levels, and patients of various education levels. Some of the limitations of the study are the fact that they only did include patients from those 2 clinics. I think they could have widened it by examining other clinics in the Dallas area, or either other clinic, or also other clinics in a larger area in the state or the country, or even larger. So that's one of the limitations. And the other is that the NVS survey is actually made for a face-to-face interview, and they delivered it as a self-administered test for the patients, so the validity of that method is still unknown. In conclusion, they found that regardless of our patients' health literacy level and internet use, they look to their provider for their health information. So strengthening the communication of our providers between them and their patients is extremely important so that we can deliver the highest quality care. As healthcare managers, we should look to implement training and other methods to improve this communication. And I think training providers to work with patients of those various health literacy levels is extremely important with our growing diversity in this country. A couple questions to leave you with. The first one is, in your experience as a healthcare manager, have you experienced patients of various literacy levels? Do you notice a difference in their ability to effectively follow instructions and appropriately answer questions? Number 2, do you find that you communicate with your patients differently based on their literacy levels? In what ways? And number 3, as a patient, what is your primary source of health information? Thank you for attending the symposium today, and I hope you gained some knowledge and enjoyed this article as much as I did. Thank you.